Number three, the very important part, how we are going to study these from which resources. Well, as for the first year video, I'll break down resources into two major components: learning oriented resources and exam oriented resources. The learning oriented resources are further subdivided into three resources. Number one is your textbooks, number two is your medical school, and number three is your boards or discussions. As for his number one, textbooks are concerned, same textbooks as I mentioned in first year MBBS video, that for anatomy, gross anatomy, you have different choices. I already mentioned you have Snell's, Gray's anatomy, BD Churasia. Uh, for histology, you have DeFure's Atlas, you have Laik Hussain. For embryology, you have Keith Elmore, you have Langman's embryology. So we have discussed these in detail, but I'm not going into detail here in second year video, because if you are watching this video, you have probably passed first year or seen the first year video. So I recommend you to stick with the resources you used in first year, so that transition for you is smooth. And most of the books, see, if you are studying Satya for biochemistry in first year MBBS, I would say that study Satya in second year MBBS for biochemistry again, because you know the book, its style, and it is easy for you to read from that book. And essentially all books are same, because one book of biochemistry is similar to another book of biochemistry. There might be little differences, but they are not significant enough that you go to whole new another book. But yeah, I'll go to it later. So as far as anatomy is concerned, I've told you same books, use the same books you used in first year. You can also add upon as you will, or whatever fits to your taste best. And as far as physiology is concerned, same books you studied in first year, either Kaitan or Kinong. As for biochemistry, same book you studied in first year. What I did, that I studied Satya in first year MBBS. In second year, I studied Satya plus Lippincott also, because Lippincott is well known for its metabolism description and diagrams. And I'll give you an example at the end how Lippincott is helpful for assessing biochemistry block E. So that you can add to your collection. And as for vertically integrated subjects are concerned, you can study books, but I prefer that you attend your classes, sessions, and you strengthen your basic anatomy, physiology, and biochemistry. Much of your proportion of vertically integrated subjects will be already covered. So this is about the learning oriented resources. Books, I just went superficially because we have explained it in detail in first year MBBS. Second is your school. Of course, school gives you discipline. It doesn't matter that one day you go, no one else is there in the class. Even sometimes you will see that your teacher doesn't come in time in the class. So you don't need to be disheartened. You should, I prefer that you should go daily to school on the same timings. You have 5 hours, say 5 hours at school on average. Don't waste those 5 hours. Utilize them, and you will see the fruit at the end. Because many a little makes a miracle, and discipline takes over motivation. You come in first year MBBS, you are very motivated, and eventually the classes shrink, and at the end of the day there are very few students and the motivation is gone. Same is with the second year MBBS. So motivation will eventually fade. What remains is discipline. You should make yourself disciplined enough that you can resist your temptation to lie in bed and do nothing, and get out and go to the school and do something productive. So this discipline is very important. We'll sometime make a video on how to manage time and how to be disciplined. But for now, going to school is important. Not only because it makes you disciplined, you have a lot of learning opportunities. We have talked a lot about learning in our first video. So learning, see, is not a choice, it's an attitude, and it develops with discipline. So going to school is important again. I know I'm repeating things, but this is worth repeating. And number three is your discussions and words. Words, of course, from first year and second year, we don't go to words, but you can go if you have free time and see what you are studying. For example, you are studying stroke in neurosciences. You go to the hospital and see a person of stroke and just elicit the Babinski reflex and see what are upgoing planters, what are downgoing planters, and how power is affected on which side of the body, and how you differentiate stroke from other diseases like Bell's palsy. So once you will see a patient, the things will stick to your mind. So this is another learning modality which you can utilize effectively in your learning oriented resources in second year MBBS. And discussions are very important, as we said in our first year video. So we won't waste much time on that again. So as far as learning oriented resources, I have discussed them. Now we go to exam oriented resources. The same exam oriented resources which I had discussed for first year MBBS, because as I've already told you, first year MBBS, second year MBBS, smooth transition. Things will change in third year. So exam oriented resources further we divided exam oriented resources into this short books or review books, to be more precise, and online resources. As far as review books are concerned, for anatomy, I think that if you are studying Snell's anatomy, that is both a review book and exam oriented book, or BD Churasia, that is also a review book and exam oriented book, and Gray's Anatomy, of course, student Gray's Anatomy is also exam oriented and learning oriented book at the same time. So any of the book you can keep for both exam oriented study and learning oriented study. As far as physiology is concerned, physiology, I've already talked about the exam oriented resources. There are many local books, and you can utilize them. For example, Costanzo, that is a good renowned book. So there is a Pakistani book also, Firdos, and this is for the books. As far as online resources are concerned, there are many online resources for learning oriented study. Ninja Nerd is one of the favorites of students. Dr. Najib is a very good online, both learning oriented and exam oriented resource, especially for neurosciences and renal module and biochemistry. You can also watch from there, though it is extensive, but it is very good resource. And there are then Kaplan lectures and Boards and Beyond lectures, and Boards and Beyond lectures are very well perceived when they are combined with first aid book. And then there are many other books for biochemistry. Of course, Lippincott Illustrated Review is very good for metabolism. And then we have done anatomy, physiology, biochemistry, and for vertically integrated subjects, you can review your medicine, Oxford Handbook of Medicine, for a short review. So this was essentially about books and online resources. The third thing, there is also third thing in this exam oriented resources: number one, books; number two, videos; and number three, your own notes, that I forgot earlier. So your own notes, I think, are the best exam oriented resources. You do learning whole year and you compress your learning into your own notes, and those notes are very helpful at the time of exam. So they become your learning oriented resource, so for whatever subject they might be. So this is essentially about the resources: learning oriented, exam oriented. I haven't gone into the detail because the subjects are essentially similar to those that are in first year. Now, number 5, the fifth part of our discussion: how will you integrate these learning oriented resources and exam oriented resources into a meaningful combination so that you get the most out of it and you benefit most out of it? Well, I'll give you an example. of combining learning oriented and exam oriented resource. In first year video, I give you the exam of physiology, how I did combine physiology, learning oriented resource and exam oriented resource, the book, guideline and my own notes on the guideline together. Here in second year video, I'll give you example of biochemistry, how I combined learning oriented and exam oriented resource. Well, for biochemistry, students are very afraid from biochemistry because it is very rote. You have to memorize a lot of things and you tend to forget it overnight. So remembering it is a challenge. So I came up with this integration that I chose my Satya and Lippincott and Dr. Najib's lectures. 3 resources plus of course school and discussions. It becomes 5 for learning oriented study the whole year. And then at the end of the year, what I did that I made charts. I made essentially a big chart of metabolic map. That map is given in Lippincott book, and whichever chapter I studied, I kept on annotating that map with enzymes, with enzyme deficiency and their diseases, with further little steps that can be added to that smaller chart to make it bigger. So at the end of the day, I had a bigger chart with everything condensed into one chart for metabolism, biochemistry metabolism. So I studied from 5 resources, but at the end I have one compressed exam oriented resource which I could use for my learning. See, many people will tell you that stick to one book and just drink it through and revise it at the end of the day. That is also a good strategy, but when you go to learning oriented and exam oriented study and you combine them both, it becomes even more effective. So I did that. So after studying biochemistry, I integrated that into metabolic chart. You can see that metabolic chart in Lippincott. It's even printed on the back of the Lippincott. And I had one chart for whole metabolism and I kept on revising it. And I remembered most of the things in biochemistry when it came to exam. And because I have extensively studied during block E, so I had also broader concept of how to approach biochemistry, not only in class but also clinically. And you'll see that most people will see that say that you will need anatomy and physiology in your life ahead, but not biochemistry. Biochemistry is minor sort of subject, but this is very wrong, because to reach the root of pathology and pharmacology, you have to understand biochemistry, and this you will know in later years of your life. To give example of the purpose of giving example of biochemistry here was to make it very apparent to you that biochemistry is not a minor subject. This was one of the purposes why I gave this example. So this is important. You should study biochemistry very well, and it will help you not only in this exam but also in pharmacology, pathology, and then years to come. So this is essentially about it. We discussed general considerations. Number 2, we discussed the resources. Most of them were from first year MBBS. Number 3, we discussed how these resources are integrated into the blocks and modules. And number 4, we discussed resources, learning oriented, exam oriented, almost similar to first year MBBS. And number 5, we discussed with an example how to integrate learning oriented resource into exam oriented resource. So with this, we come to an end of general modular guidelines of second year MBBS. And if you want us to make specific videos on specific modules, we can also do that, but of course that will take very much time. We cannot integrate everything in this one video, but we have tried to be as comprehensive as possible. Hope you will get something out of it, and if you have any questions, please let us know. Thank you very much for watching.